Alright, my name is Kwan and today I'll be performing my N190 physical assessment on this bear. Okay, before I start my physical assessment, I've already tested for my patient's vision acuity for cranial nerve number 2. My patient's Snellen chart is 20 out of 20, uncorrected bilateral. I also test for my patient's vital signs. My patient's vital sign is the following. Temperature is 98.6. Pulse is 70 beats per minute. Respiratory is 16 breaths per minute, regular and labored and even. I also test for my patient's blood pressures using a blood pressure cuff, which is 120 over 80 millimeters of mercury on the left arm at the sitting positions. And then I also ask my patients for pain level. My patients state there his pain level is 0 out of 10. If his pain level is above 0, then I will be performing O cards and ice. Alright, so for my patient's interview sessions, I'll be knocking the door. Knock, knock, knock. Hi, my name is Kwan, and today I am your student nurse from West Coast University performing a physical assessment on you. This process is going to take around 15 minutes to do it. Is that okay with you? Patients say yes. Alright. First, I will need to ask you for your first and last name, which is date of birth, and you can also check for your wristband. Alright. Patient is indeed Mr. Bear. Alright. Are you allergic to any medications? Okay. Are you allergic to any food? Are you allergic to any latex? Are you allergic to any environmental factor? Right? Patient has no known allergy, and then I ask patients for allergic orientations. Alright. Are you allergic to where are you today? Okay. And then do you know what time of day it is? Do you know what date it is? Do you know who is the president? Alright, patients is alert oriented time 4, and then I'll ask patients for moods and overall well-being. Alright. What is your mood for today, Mr. Bear? Okay. Do you usually wake up happy? Awesome. Is there any changes to your moods for the past month? Changes mood for the past year? Patients indicates no, and patients seems to be in a good mood. Alright, Mr. Bear, I'll ask you for a couple questions for bowels and your bladders, okay? What is the color of your bowels? What is the consistency of your bowels? How often do you have a bowel movement? And when is the last time of your bowel? Alright? And then what is the color of your urines? Do you have any pains or burning sensation when you urinate? Okay. What is the odor of your urines? Okay. How often do you urinate? And then when was the last time you urinated? Okay. I will go ahead and perform my head-to-toe assessment on my patients now. I'll be performing my hand hygiene and ask patient for consent. So for the physical assessment, I'll be touching you. Okay, is it alright if I touch you? And the patient's giving me consent, and I can go ahead and perform this. So I'll be using my pen light to inspect for a patient's head. Alright, patient's head, skin is white, head is round. There's no lumps or lesions on the head. And then normal hair distribution as well. Okay, so I'll be inspecting for your ears, okay, using my pen light. I'll be looking at the patient's ear, looking at the patient's right ear. The external auricular is round and pink. There is no drainage or cerumen. And then for the left ear, same thing, pink. There is no drainage or cerumen. I'll be asking patients, can you lean backwards for me a little bit? I'm gonna take a look at your nose, okay? So patient's septum is straight and nares is patent and non-inflamed, which is a normal finding. So I'll be testing for your eyes, okay? First, I'll be testing for patient's direct and consensual constrictions. So I'll be shining the lights onto patient's right eye. First is for direct constriction. Second time is for consensual constriction. Same with the left eye. First, direct. Second, for consensuals. Alright. Patient's perla, which is pupils equal round reacted to lights and accommodations. Next, I'll be testing for patient's cardinal fields of gaze. Can you follow my pens without moving your hands? Alright. And now we move my pens. 6 cardinal fields of gaze. Alright. Patients were able to follow the 6 cardinal fields of gaze. And next, I'll be asking patients to follow my pens. I'm gonna move it towards the patient's nose bridge. Alright? Patient has accommodations and convergence. Next, I'll be testing for patient's mouth. Patient's oral mucosa is pink and moist. Teeth are white, no dangers. And then can you lift your tongue for me? Alright, tongue. The frenulum is in the middle. I'll be using this cotton swab as my tongue depressor, and then I will touch the patient's tongue. Can you say ah for me? All right. Patient's tonsils is grade 1 bilaterally, and then, all right. And I will use this tongue depressor to touch the back of your throat, okay, for gag reflex. All right. Patient's is positive for gag reflex. Next, I'll be testing for patient's jugular vein distensions. Can you turn to the right for me? And then to the left, right? And then can you lean backwards 45 degrees for me, please? Thank you. All right. Patient has no jugular vein distensions bilaterally. I'll put my pen lights down and do hand hygiene. I'll be testing for patient's cranial nerves. First, I'll performing the Romberg test, testing for cranial nerve number 8. Can you stand up straight for me? Put your feet together and then your hands side by side. I'll be here in case you're falling, okay? All right, just close your eyes, and then I'll be timing for 20 seconds. After 20 seconds, patient seems to be additional swaying, which is a normal findings. And next, I'll test for gait. Can you walk 5 steps for me, and then walk back from heel to toe? All right, patient has normal gait. Next, I'll be testing for whisper test. I'll be covering patient's left ear and then whisper something to his right ear, and then ask patient, can you please repeat what I said? Okay. All right, patients were able to follow, to repeat what I said for the whisper test. Next, I'll be testing for the smell. I have 2 cups right here. One is vanilla and one is peppermint. I'll be uploading patient's left nose and then ask patients to smell for me. All right, it is indeed vanilla. And then occluding patient's right nostril. All right, it is indeed peppermint, which is patients have normal cranial nerve number 1. Next, I'll be testing for upper and lower cerebellar test. For upper cerebellar test, can you please flip your hands fast for me? All right. Can you use your thumb to touch all your fingers for me? Okay. For the lower cerebellar, can you move your right legs, your right feet to your shin for me, please? All right. And then your left leg to your shin. Okay. Patient has normal cerebellar test. For testing for cranial nerve number 11, I will be asking patient, can you move your head back and forth for me? All right, up and down, side to side. Okay, I'll be placing my hands on your shoulder. Can you shrug for me against my resistance? All right, patient's able to shrug against resistance, which is indicate normal for cranial number 11. For facial, can you smile for me? Can you pop your face? Patient has normal patient has normal facial expressions for cranial number 7, and for cranial number 5, I'll be placing my hands in the tragus right underneath your jaw, and then can you open your mouth against my resistance, please? All right, patients were able to open his mouth, which indicate that he has no crepitus at the temporal mandibular joints. All right, next I'll be performing hand hygiene, and then I'll be palpating patient's lymph nodes. The first lymph nodes, it's going to be the pre-auricular lymph nodes, which is in front of the ear, post-auricular lymph nodes, which is behind the ears, occipital at the base of the skull, and then the retropharyngeal at the joints, the angle of the jaw, and then submaxillary is middle underneath the jaw, and then the midline of the mandible, which is the submental. Next, I'll be testing for the superficial cervical chains, right above the sternocleidomastoid muscles, the patient's neck, and then the deep cervical chains, which is behind the sternocleidomastoid. And then for the left side, do the same thing. All right, there seems to be no, all lymph nodes are non-palpable. I also forgot to do a supraclavicular lymph node, which I'm gonna do right now at the clavicle. All right, and all the lymph nodes are non-palpable, which indicates a normal findings, right? I'll be testing for patient's trachea. Patient's trachea, can you please swallow for me? All right, patient's trachea is in the middle. While that, I'm gonna palpate for the thyroid glands. Thyroid gland is non-palpable and firm and there's no lesion. Next, I'll be testing for the skin trigger. I'll be pinching a bit of your skin just right above your clavicles, okay? All right, and patient's skin trigger is elastic, which indicates the patient has normal hydrations. Next, I'll be testing for the arms, I'll be washing my hands, and then, all right, I'll inspecting the skin of the arm. Skin is white, normal hair distributions, and then I'll be touching the patient's arm. Do you feel any pains in going down? Patient says no pains. Patient's arm is warm to touch as well. And I'll be testing for edema at the bony prominence. There is no edema. I'll be testing for brachial and radial pulse. For the brachial pulse, I will test for it bilaterally. Pulses are even and there's no weakness. For the radial pulse as well. Pulses are even and there's no weakness. Okay, can you please squeeze my hand, please, as hard as you can? All right, patient has equal forces for the muscles. Next, I'll be testing for cap refills. For the right hands, I'll be just pressing on your nails bed, okay, to see how much blood flow goes back. All right. All right. So for cap refills for both arms is +2, which is a normal findings. Next, I'll be asking patients to perform some range of motion tests. Can you put your arms out and then touch your shoulder for me? All right. Can you put your hands down side to side? Raise your hand up for me, 180 degree, and then put your hand down again. All right. Patients were able to follow and perform and has normal range of motions. For the reflex, I'll be performing hand hygiene and cleaning my reflex hammer. For the biceps, I'll be hitting, using the smaller parts, I'll be hitting the antecubital fossa bilaterally, testing for forearm flexions. And for the tricep, I'll be using this, tapping on the elbows bilaterally, testing for forearm extensions. All right. So it's normal, patients have normal flexions and extensions. And then using the long part, I'll be testing for the brachial radialis, which is 2 or 3 inches above the patient's wrist. And then I'll tell patients to do supines. All right, patients have brachial radialis reflex. And then I'll be moving on to patients' knees. Have you had any knee surgery before? Patients say there's no knee surgery or injuries before. So I'll use the long end of my hammer and just tap just right above the kneecap of patients. All right, patients have long leg extensions, lower leg extensions bilaterally. And then I'll be performing my hand hygiene, and then I'll move on to the heart and lungs. All right, I'll be listening to your heart and lungs, okay? Before that, I need you to take off your top, and then I'll be taking a look at your skin, okay? So patients agree and taking off his top. Patient's skin is white, normal hair distributions, and then the thoracic cage is even and symmetrical. And then I'll be listening to his lung sound and heart sound. So first, I'll be using the bell of my stethoscope, listening to the patient's carotid arteries. So patient's carotid arteries, the right, all right, it's normal, and then 1 at a time, and to the left, normal. All right, there is no bruits, which is a normal finding. And then I'll be using my 2 fingers to palpate the patient's carotid arteries. So 1 side at a time. Okay, patient's carotid artery is even, and there is no, there seems to be no deficit. Okay, I'll be auscultating using the diaphragms for the heart sounds. So for my patient's heart sounds, I'll be listening to the right first, the second intercostal for the aortic pulse. Okay, and then S2 is louder than S1. And then in the left sternal border, I'm listening for monic. All right, S2 is louder than S1, and then into the Erb's point, which is the third intercostal, S2 is equal to S1, and then the fourth intercostal, which is the tricuspid valve, S1 is louder than S2, and then for the mitral, which is the fifth intercostal, S2 is louder than S1. This is also the apical pulse. I will also leave my stethoscope in for a full minute for apical pulse while I'm palpating the patient's left radial pulse. Okay, after 1 minute, patient's apical pulse is 70 beats per minute, and patient's radial pulse is also the same, which indicates no pulse deficit. Next, I'll be listening for patient's lung sound. So I would use the diaphragm of my stethoscope again, listening for patient's lung sound. Every time that I move my stethoscope, can you take a deep breath for me? All right. So 1, 2, 3, 4, 5, and 6. All right. There is no abnormal sounds for patient lungs, and patient seems to not using any accessory muscles for breathing. And then for the back, can you please turn to your back for me? And this is going to be for 8 spots. So 1, 2, 3, 4, 5, 6, 7, 8. Okay, and I'm gonna tell patients to turn to the right, and then can you raise your arm for me, your right arm? Listen to the lateral sun sound, and then your left arm, the lateral lung sound. Okay, patient seems to have no abnormal lung sounds for it. Next, I'm gonna be testing for patient's abdomen. All right. Okay, upon inspection, patient's skin is white. There's no normal hair distributions and no lumps or lesions. And then abdominal contour is normal, flat, there are no pulsations. I will be auscultating patient's abdomen. Using hand hygiene and cleaning my stethoscope, I'll be listening right lower quadrants for 15 seconds, right upper, left upper for 15 seconds, and left lower for 15 seconds. Alright, so this is a total of 16 gurgles per minute for all 4 quadrants. And then with the bells, actually, I'll be listening for patient's aorta, and then listening for patient's renal, iliac, and femoral. And there is no bruits, which is normal findings. And then I'll be percussing patients all 4 quadrants. Right lower, right upper, left lower. Alright, and it's all tympanic sounds, which is normal findings. Then next, I'll be going to lower extremities. Can you please sit up for me? Alright. Upon inspection, skin is white, warm to touch, normal hair distributions using the dorsal part. The temperature is warm. Patient has no edema in all bony parts. Do you feel any pains as I move down? So patients indicate there is no pains moving down. Using my fingers, I'll be testing for posterior tibialis. So patient's posterior tibialis is even and there's no pulse weakness. I'll be testing as well for the dorsal pedis, which is between the great toes and the first toe. Alright, pulse are even and equal. I will press my hands against patient's feet. Can you press against my hand, please? Alright, patient is able to exert muscle strength on my hands. And I ask patients to do some range of motion. Can you put your feet up like this for me? Alright, can you move it side to side? Alright, patient is able to perform range of motions from its feet. And that will be the end of my physical assessment. I will be opening patient's curtains and then also lower the beds to the safety positions and tell patients, all right. And that is the end of my physical assessment. If there's anything else you want to tell me, please let me know, okay? All right, and that's the end of my physical assessment. Thank you.